Good evening. I'd like to welcome all of you to our first in a series of webinars that we'll be conducting on various topics of interest that affect all of us. And tonight I'd like to welcome Carol Janz Booth. Carol is a senior health plan specialist who holds dual degrees in health education. She has over 25 years of experience as an educator. She holds licenses and certifications that allow her to offer customized planning as Medicare beneficiaries such as yourselves make initial elections. She also ensures her clients are apprised of any changes in the marketplace. My daughter Jennifer first met Carol at Belfour Senior Living, where she came to assist seniors needing to make changes to their Medicare plans. Carol warmly and patiently communicated Medicare updates and assisted those in making yearly changes to their Part D prescription drug plans. This is an overview of Medicare basics to help you customize your Medicare options so that when you're ready, whether it is in the near future or later when you retire, you'll have a basic set of tools to make an informed decision. We hope you'll find the webinar helpful. Carol's contact information will be provided at the end of the webinar, and we encourage you to reach out to her for additional personal Medicare questions and assistance. We would also encourage you to ask only general questions at the end of this seminar tonight. And I just want to thank you again for being here. Carol, I'll hand it over to you.
Thank you, Bill and Jen, for inviting me to speak this evening. I'm really pleased to be with you tonight. I must admit I am getting over a cold, so I appreciate your patience with my rather strained voice. So, I'm a baby boomer, as perhaps many of you are. 10,000 of us will turn 65 today and will every day until 2030. We boomers are living longer and some of us are working longer, and we will have an enormous impact on healthcare as we age. My goal this evening is to provide you with some basic knowledge and resources as you prepare, plan, and protect your health in the Medicare decision-making process, whether it be in the near future or down the road. So let's begin with the first slide. Medicare basics. How do I prepare? What are the parts that I'm hearing about? When can I sign up? What about the costs of Medicare? When are my enrollment periods? At the end of this course today, you will have some takeaways to think about and to plan as you prepare for your Medicare decisions. Medicare is a federal health insurance program for people 65 and older, and for some who have disabilities under age 65. And Medicare has Parts A and B. They're called Original Medicare. I'm going to be referring tonight to Original Medicare, and those are Parts A and B. Reason being, Medicare is 50 years old. It was passed as an act in 1965, and since its inception, we call Medicare Parts A and B part of Original Medicare. Original Medicare shares costs with you, and we're going to talk a lot about cost sharing this evening. So that's a buzzword that you'll want to keep in mind. Original Medicare doesn't cover everything, and you'll see a slide enumerating some of the things Medicare does not cover. One size doesn't fit all. So that's important that we can certainly customize and tailor your plans to your needs. And good news, you're not locked into one plan forever, so no worries, don't panic. You do have capabilities of changing and switching your plans. Important is to follow the rules and pay very close attention to the exceptions. So, onward to planning, preparing, and protecting. How do I prepare? Well, we've got 3 questions, burning questions. When am I eligible? How do I get started? And what about my current coverage? So I imagine as you're sitting here this evening, some of you have probably been barraged by many different pieces of mail that you've been receiving. It can be overwhelming. Some of you may be thinking about, when am I eligible? Is it too soon to start my research? And I imagine many of you have gone through this task with perhaps some of your aging parents. So I do know that you have some basic knowledge of Medicare, and it'll be nice for you to underscore some of what you do know about Medicare. We're going to talk about the age 65 rule on this slide. So age 65 rule. If you're 65 years old or you're under 65 and qualify on the basis of a disability, you're eligible. If you're a U.S. citizen or a legal resident and have lived in the U.S. for at least 5 consecutive years, you're eligible. Quite frankly, in my years of experience, I have several individuals that are clients that have naturalized as U.S. citizens, have become eligible after they've been here for 5 years. Even if you're already collecting Social Security, you must wait until you are 60 years of age. And we're not going to delve into when to collect Social Security. That's a whole nother webinar in and of itself. So you must wait till you are 65 years of age. And your spouse's age doesn't count, so you can't double dip there. On the next slide, how do I start to prepare? Well, you really must take the initiative. You, the beneficiary, and you are going to be called the Medicare beneficiary of this entitlement program, you need to take the first step. You can go online to start to peruse the Social Security website, but my advice is to call and make an appointment or by visiting your local Social Security office to initiate the process. They handle most of the paperwork for joining Medicare, and it gets a little more complicated if you work longer than age 65. If you are drawing Social Security benefits when you age in, which is another way of turning 65, we in the industry call it aging in. So when you age, Social Security should automatically enroll you in Medicare Part A and B, but do check a few months ahead with your local office. One thing I do recommend, incidentally, is when you do go to the Social Security office to avoid those dreaded lines by making an appointment. Take notes, write down the representative's name, see if you can get a phone number and the card of the representative that you speak with. So, I imagine some of you this evening have current coverage. You don't have Medicare. So what about your current coverage? This is where you need to do some research on your own. As you make your decisions about Medicare, I underscore this: keep your current coverage. Don't dash to make any rash decisions. You may have a retiree health plan from your former employer, so you might have some contact numbers there. And certainly if you're still working, you would have a benefits specialist or a human resources contact. Find out if you can keep that coverage once you age in or turn 65 and how much it's going to cost. Now, your HR benefit person is not going to be able to project what the cost of your plan is going to be several years down the road because, as you are well aware, each year healthcare costs are taking a heavy hit and the employee's cost share continues to go up. So year to year, your HR specialist would know what your costs might be, or you could actually ask what the previous cost of the year would be. If you have an individual plan that you've purchased on your own, do not cancel that plan until you have made a decision about when your Medicare is going to be effective. We're going to talk a little bit more about that in detail down the road. So I'm going to launch into the parts. Let's dissect the parts of Medicare. In reviewing again, Medicare Parts A and B are part of Original Medicare. Why does Medicare use the word part? Well, when Congress passed the law in '65, instead of calling it a chapter or a section, they labeled the parts as parts. So it is a label that Congress used when they set up the law, hence Medicare Parts A, B, C, and D. And again, Part A and B are called Original Medicare. We have Part A as hospital insurance, Part B, medical. Part C is a Medicare Advantage plan. It's an option that combines A and B and generally includes Part D for drug. And lastly, Medicare Part D. It's the Medicare prescription drug coverage, and that was actually launched in 2006. On to the next slide. How do I get Part A and B? Incidentally, Part B for boy is voluntary. I want you to remember that. Part B for boy is voluntary. So some people get Part A and B automatically. And if you're getting benefits from Social Security, as I mentioned earlier, you will get Part A and B starting the first day of the month you turn 65. So it's your month of birth. Unless you were born on the first of the month, in which case it is the first of the month prior to. Some people have to sign up for Part A and B, as I mentioned to you earlier. And in my experience, it's a random event. Some people get enrolled in A and B, and they've done nothing. So that's why I reiterate, it's best to set up an appointment with Social Security and make certain that you're on track. If I'm not automatically enrolled, when can I sign up? Well, there are 3 different enrollment periods, and I'm going to detail those at the end of today or tonight's presentation. Excuse me, right now we're actually in annual enrollment starting October 15th going through December 7th. A little more detail on these enrollment periods. So, if you are not yet 65, you have an initial enrollment period. We call this the little honeymoon window. It's a 7-month window surrounding the month of birth that you turn 65. 3 months prior, the month of 3 months after, unless your birthday falls on the first of the month. Then we have a general enrollment period each year from January 1st to March 31st if you did not sign up when you were first eligible. But that's not going to happen to those that are attending tonight's webinar. That's one oversight that people make, and it can cost you dearly because not only do you have to wait for your coverage to begin until July, but you may pay a late enrollment penalty for Part B. And then we have this category. It's really kind of a catch-all, but remember, Medicare has very specific rules because it is government regulated, and there are always exceptions, but we have to make certain that these exceptions follow the rules. And one exception would be that you're working or your spouse is working beyond age 65, and you fall into what's called a special enrollment period. So it's any time you're still covered by group insurance, or what if you move from Larimer County to Arizona? You would be moving out of a service area. That's also called a special enrollment period. On the next slide, we're going to discuss how much Parts A and B cost, and what about this pesky late enrollment penalty. Part A is premium free, so you pay nothing if you or your spouse have paid Medicare taxes while working. So if you or your spouse have made payroll contributions for 40 quarters, that would be 10 years, you will not pay a monthly premium for Part A. Part B is assessed on income, and most people pay a standard monthly premium, and they base it on your IRS tax return 2 years ago. The standard monthly premium for Part B in the year 2015 is $104.90 per person per month. This is based on a couple filing jointly, married filing jointly, earning $170,000 a year or less, or if you file as a single person, it's $85,000 or less. This is tweaked every year with the cost of living adjustment called COLA, and we won't know the Part B premium for 2016 until probably the second week of November. If you're a high wage earner, you're going to be assessed what's called a surcharge, and you will pay more for Part B. Part B can be deducted from your Social Security check, or if you're still working and not collecting Social Security yet, you will be billed a paper bill. Yes, I said paper bill, quarterly. So just be prepared for that quarterly paper bill. Now let's talk about the Part B late enrollment penalty, which none of you will be assessed because you're going to be on top of it. And it is 10% for a full 12-month period that you didn't sign up for it. So it obviously can be a chunk of change. Remember, if you don't sign up for B because you don't need B, because you're still working and get group coverage, you will have a window called a special election or enrollment period. So don't panic there. All right, enough about penalties and costs. Let's get down to some basics. We're going to dig into some basics on what Part A covers and B. So, easy way to think of this is what's covered in a brick and mortar hospital. Your hospital stays. What is your room and board? Your inpatient stay per day. Your skilled nursing facility care. Your home health care services and hospice care. Part B is everything outside of hospital, so to speak. So your medical services, your specialists, lab work, diagnostic services, your outpatient hospital visits. And as we know, we're doing everything to stay out of the hospital, so a lot of us go in for ambulatory day surgeries, right? your physical therapy, your occupational therapy, your cardiac rehab, your diabetic testing strips, your durable medical equipment like wheelchairs and oxygen supplies, and preventive services. So we're going to learn how to speak Medicare. You'll be fluent, a little more fluent than when you first started this evening, and some basics in understanding how Medicare cost sharing works, because I am going to be referring to that in our next few slides here. And it's really important that you understand the cost sharing in Medicare, because it is similar but yet different than your current coverage that you've had, your professional careers, or your current insurance as you know it. Premiums, we know, are a fixed amount that you have to pay to participate. They're usually charged by the month. Cost-sharing methods, and this is really the buzzword now, is all the cost sharing. We have deductibles that are a preset amount that you pay first before Medicare or private company begins to help you with your costs. Co-pays, called co-payments. It's a fixed amount like $10 for your office co-pay for a service or a product, including drugs. Co-insurance is a biggie. This is where you split your health care costs with the plan on a percentage basis. So most of us know health insurance, and I'm a boomer born in 1955, so the backbone of America was an 80-20 plan. The plan paid 80%, we paid 20, or maybe even 90-10. It's the relationship that you enter with the carrier or Medicare, whereby you pay a portion and Medicare or the private insurance company picks up another percentage. So we're back to talking about some of the basics on preventive care, and I'm not going to spend time tonight going through each and every one of these items, but I did want to underscore that under the Affordable Care Act, if any of you have private insurance now, your preventive services are covered. Well, Medicare expands that to include 21 screenings, including a yearly wellness exam. So there are preventive services that are mandated to be covered. And you can actually look these up. I'm going to give you a list of resources. There's a great list on Medicare.gov to enumerate the more specifics on these 21 screenings that are covered. We talk about what's covered. How about what Medicare doesn't cover? And I see this in some clients that are terminally ill and in hospice care, and unfortunately it's too little too late. Long-term care, I just want to elaborate on that for a moment. Long-term care is not Medicare. Long-term care provides custodial care, like transferring from the bed to the bathroom, like bathing, like dressing, like feeding. They're called activities of daily living, and there are 6 of them. And if 2 of these are triggered, you can go into a long-term care claim. This is a plan, a policy, a product that Bill and his team can help you out with, but it is not Medicare. And I see people, unfortunately, get into some dire situations because they think they have long-term care and they don't. And their caregiver is their spouse, and caregivers get sick. This is not to be confused with home health care. So I'll get off my soapbox about that. But if, as you can see, there are some routine procedures, cosmetic surgery, etc., that are not covered. A good way to see if a procedure or a service is covered, you can go into the search bar on Medicare, and there's is my test covered, and you can type in the name of your test or service. And just one other comment. As we know, and I can speak for myself, eyes, ears, and teeth typically do not improve with age. Medicare is rather lacking in a robust benefit for eye care, hearing tests and hearing aids, and dental care. And I listen to a lot of music, a lot of rock and roll in the 60s, and I'll be probably one of the first to have a cochlear implant for my hearing. So just remember, you want to figure out what Medicare doesn't cover. Don't assume it covers everything. So this is a key slide here. We're coming to a crossroads. What are your choices? There are two ways to get your coverage. You have original Medicare, right? Your A and your B. That's choice number one. And if we go on this little decision tree to the left-hand side of the screen, we have Part A and Part B. Then we're going to decide if you want a supplement called a Medigap plan, also referred to as a Medicare supplement, to help fill in the gaps that original Medicare doesn't cover. Original Medicare pays for 80% of Medicare-approved services. That leaves you, the beneficiary, exposed for 20%. I use the scenario as follows. I have a cardiac event. I land in the ICU for several days. I end up being discharged to a skilled nursing facility for cardiac rehab. 20% of what? I cannot give you a finite dollar amount, so please, please do not leave yourself exposed for that 20%. I see a lot of people, in all honesty, thinking they're good to go, they have A and B, they're covered, and they have this lofty unknown number, 20% exposure, and it can bankrupt you, and I've seen it happen. So your other choice would be, in addition to the Medicare supplement to help you with your hospital and medical services, you would decide if you needed Part D for drug. Notice that original Medicare did not include a drug plan. So that would be your prescription drug coverage. Easy way I remember it is D for drug. Let's go over to the right-hand side of the screen, choice 2. We have a Medicare Advantage plan. It's called Part C, but most folks know it as a Medicare Advantage plan. And right now on television, you've probably heard on a daily basis, as we approach open enrollment, you're hearing advertisements for Part D prescription drug plans, supplement plans, and Advantage plans. These plans that are often called $0 premium plans, $0 premium plans. Let me just simplify this. The idea of a Medicare Advantage plan, it's simple. It's a single plan that's run by private companies that combines A and B and usually includes D for drug. So Medicare, Centers for Medicare Services, pays a private company a specified dollar amount to manage the risk. We have healthy and we have very sick. So the Centers for Medicare Services, again, pays a company, private company, to manage you. And they manage you by coordinated care plans like HMOs, PPOs. So you typically choose a primary care provider who manages your care with specialists and hospitals. As I said, these plans usually include Part D. If you're a veteran, some individuals choose to do their drug plan through the VA, which is completely fine. So you need to decide if you need a drug plan. So in a nutshell, you have two choices. So now we're going to do a little contrast, and I'm going to, for illustrative purposes, go from left to right in the next few slides. So remember our choice 1, we keep original Medicare and add a supplement. The supplements are not managed by the government, they're privatized. And then we have a Part D, and they're offered by private companies. Choice 2 is to choose that single plan, your Medicare Advantage plan, called Part C. Reading left to right, this is option 1, your supplement. Option 2, Medicare Advantage plan. So Medicare, starting on the left, first bullet, Medicare designs the plans. Every company has the exact same benefits. What a concept. Hallelujah. Wow, they're standardized. Under going to the right-hand side, Medicare pays a private company a fixed monthly rate to take over your care, and they're not standardized. They're not the same. Back to the left, your supplement covers most or all costs that original Medicare doesn't cover. Plan F, like Frank, covers 100% of Medicare approved services. So if I had a Plan F supplement, F like Frank, and I probably have over 25 companies to choose from that offer a standardized Plan F, or it could be an N like Nancy, or a C like Carol, or an A like Apple. These plans vary in cost, but they're usually more expensive than an Advantage plan. So let's go to the right-hand side. The Medicare Advantage plans are subject to copays, coinsurance, but they do have a maximum out-of-pocket amount, so you are capped. And it might be like a max out-of-pocket per year of, let's say, $4,500 or $5,000. They are less expensive per month, and as I have said, you will hear, or if you haven't paid attention, your ears are going to perk up when you hear low or no monthly premium. Continuing on this slide, there are trade-offs. Original Medicare supplement, great news. You have freedom to choose your doctors. There are no provider networks. For those that want to choose their doctors, which is getting tricky these days because not all doctors take new patients or take Medicare, you may pay for the freedom to choose. Medicare Advantage plans require a service area provider and network, so you have to stay in that network of providers, excuse me, and you would have to get a referral in most cases to see a specialist. Medicare supplements, going to the left, it's portable, it travels with you. Great news. I have a place in Arizona maybe, or maybe in Florida. So my Medicare supplement works in Florida just like it does in Colorado. With a Medicare Advantage plan, this could be limiting. You have to stay in that service area, which is dictated by county. So if you folks travel and you plan on traveling a lot, or you have second homes, or spend time with your children out of state or in another county, pay attention to this. With a supplement, you need to add a drug plan. With Medicare Advantage plans, most include a drug plan. As I mentioned, supplements are standardized. With Medicare Advantage plans, they change year to year. With a supplement, they have discounts for hearing, vision, and some offer health club memberships. With Advantage plans, some bundle some added value plans. So again, there's no right or wrong choice here, folks. You need to choose what feels right to you and what meets your needs. I'm taking a sip of water here, bear with me. So let's get on to the Part D prescription drug plan. Most of you probably have a prescription plan included in your health insurance right now. And trending, I say, under the Affordable Care Act, I'm starting to see some separate deductibles for prescription drugs. I'm seeing a lot of interesting things happening with prescriptions. People are being asked to step up from generics first before they're prescribed a brand name drug, so it's getting a little trickier to navigate the prescription drug piece. So your drug plans have various premiums. Again, if you're a high wage earner, you're going to pay a little bit extra. It's that surcharge on your monthly premium. Some individuals may qualify for extra help. You will have resources to contact there to see if you might qualify. Late enrollment penalty, here we go again. This is something you want to avoid. However, as long as you understand what the penalty is, you may choose to opt out and join at another time. So don't go more than 63 days in a row without a drug plan or what's called a creditable drug plan. And your drug coverage with your employer-sponsored coverage or your individual plan would be considered creditable, which means as good as Medicare's. The late enrollment penalty quickly is calculated 1% of the national premium times the number of months you were eligible but didn't join. And it's forever. So the national base premium for 2015 was $33.13, so it'd be about 33 cents times 12 or times the number of months that you did not join, and they would tag that on for the rest of your life. So some individuals just are uncomfortable being forced to buy something they are not using. And that's fine as long as you understand the late enrollment penalty down the road. And many people do not take prescription drugs, so they do not want to pay the premium for a product or drugs that they're not taking. This is a real easy slide just to show you the stages. I'm not going to dwell on the donut hole. Everybody wants to know about the donut hole. But there are 3 phases in your drug plan. So you pay a premium, and if a deductible applies, you pay that. But in the initial phase, you and your plan cost share, and you pay a co-pay until a certain dollar amount is reached. Then you gravitate into what's called the coverage gap, which is endearingly been named the donut hole. And you pay again some of the costs of brand name and generic drugs. By the year 2020, the coverage gap or donut hole will almost close. So by the year 2020, you'll only be paying about 25% of the costs of the drugs. And then for those that are on a laundry list of drugs, as an example, my almost 94-year-old mother in assisted living is on a lot of different medications, and she is in catastrophic every year in the month of February. So sometimes you go quickly through the coverage gap right into catastrophic coverage, where you're paying a nominal fee for your brand name drugs, your specialty drugs, and your generic drugs. I'm going to skip over the next slide, but I wanted you to have it if any of you are really interested in this. You can see what your cost sharing is. Remember, in becoming Medicare fluent and learning a new language tonight, you can see what the 2016 thresholds and limits are. This is detail for those of you that are interested. And I'm going to now begin to wrap up here, but I do want to talk about a few common Medicare mistakes that I've seen clients make. Part B enrollment, they forget after they leave their job. they're so excited about retiring and taking that trip around the world or just relaxing that they forget. And it's a fairly narrow window, so don't forget. You can plan and prepare ahead of time. Also, retiree coverage and COBRA coverage is not active employer-sponsored coverage. I see people get into this, what's called the COBRA trap often. So just because you're in COBRA doesn't mean you can sign up for Part B at any time. Under the Part D prescription drug plan, I see a lot of clients. Right now, my really busy time is to meet with clients and say, what's changed in your prescription drug plan? What are you not taking? What are you taking? And people leave this in autopilot and think that it's the plan that's going to meet their needs every year. And there's so many new plans and new formularies, new drugs. So don't leave your Part D in autopilot. And do not think that just because your spouse has one Part D plan that it's the right one for you. Also, going out of network with your Medicare Advantage plan, I've seen people pay some out of network costs by not paying attention to the provider, excuse me, provider network. In October, so let's start at 1 o'clock. This is important enrollment information. This is what we're in right now, October 1st through the 15th, where I'm starting to compare plans with my clients. And then the 15th to December every year, changing outshore Medicare Advantage or prescription drug plans. Because supplements are privatized, they automatically re-up. And then your coverage renews every January. And then you have a window disenrollment period from January 1st to February 14th. If you have buyer's remorse, but they're very strict rules as to what you can switch to. How does my other insurance work with Medicare? So I'm going to let you follow this slide on your own, but if your group plan has 20 or more employees, your group coverage pays first and is called primary. If you have retiree coverage, Medicare pays first. So we're talking about primary and secondary payers. Working beyond 65, and I know that I'm going to be. So it's a big wave of us boomers. Is enrollment required? So as I said in the beginning, you want to check with your benefits administrator to see if it makes sense for you to sign up for A and B in addition to your current coverage. It may not make sense for you to sign up for B. In some cases, your employer may require it. So you want to, again, think about what are the requirements of the employer-sponsored health coverage, and then retiring at 65. I believe some of you listening tonight are probably planning for that. So again, the 3 Ps, prepare, plan, and protect. You've got to start ahead of time and don't miss out on that 7-month window. Avoid a gap in your coverage. So I see this a lot when people are retiring and they're celebrating, they're taking an extended vacation or retirement trip of a lifetime, and the 63 days lapse, so then they have to wait. And then I think it's really important, again, just like you would meet with Bill and his team of experts, you've got to take inventory every year. See what's changed in your life. Take stock. Do an assessment every year. Review, maybe you've had a serious diagnosis or are managing a chronic disease. Maybe you've got an upcoming surgery or having your knees replaced so you can still ski those double black diamonds like I think I can. Maybe you are planning a surgery in the next few years, that may affect the plan that you choose for that year. So do a yearly assessment, and it's helpful. Whomever you select to work with, align with someone who has your best interest at heart in making sure that you understand what you can change and what you can't change. So the next two slides will really be takeaways for you. I want you to think about the following. These are things for you to consider. Take a good look at yourself. How's your health? Look at your snapshot the last 5 years or the last year. How much did you spend last year? What's important to you? Some people really value choosing their specialists and don't want to have to be referred and want to choose their own doctor. Be realistic about the costs. You know, in a perfect world, we can't always choose and get what we want. So while a Plan F like Frank supplement might sound like that's a very rich way to go, it may not be cost effective. So there are two slides covering costs, your choices, your prescription drugs, your other coverage, quality of care. There are some ratings that you can look up on Medicare.gov, the convenience of a plan, and travel. Of course, any health plan covers emergencies worldwide. So, but if you do travel, this is something to consider. So, I've given you a lot to think about, and perhaps some of this is repetition. Perhaps for some of you, this is new information, but these slides and the resources on the next slide here will get you jump started, or at least being a little more familiar to embrace the change and not be fearful. There's something called analysis paralysis, where there's so much information you just get paralyzed with it. And I have clients bringing me in boxes of mailers and so much information. So I truly hope that I have broken this down into a format that is useful, and I very much appreciate your attendance and bearing with my husky voice this evening. I welcome any questions to my work email. Be happy to address those, and let me check with Jen here to see if we've had any general questions. Let's see. If I'm over 65 and my spouse is 55 and working, can I at over 65 be covered under my spouse's plan? That's a great question. You would have to check with the spouse's plan and benefits administrator. I am going to speculate, because of dependent coverage, and this is again a trend, and boy have I really seen this with the Affordable Care Act, rates for dependents are just out of sight. And I can honestly say that, well, first of all, you're over 65, so you can't get a dependent rate. You have to go on to Medicare. So unless they offer a retiree plan, you would have to check at the expense of the retiree plan and compare that to what Medicare would cost. And this is something that a broker could help you with. And I do this analysis all the time as a side-by-side comparison. So check with the administrator with your spouse's plan. That brings up also, again, an underscoring that you cannot purchase an individual health plan when you're over 65. So any other questions? I would really be happy to entertain them to my email. And again, my voice is fading, so I truly appreciate your patience with me. And have a great evening, and what a glorious day it was today. Thanks so much, Jen and Bill.